In the Philippines, I think everybody knows this, that we continue to experience one of the fastest growing HIV epidemics in Asia Pacific, particularly among gay, bisexual, and men who have sex with men. And many people we wanted to reach were not coming through clinic doors. So some live hundreds of kilometers away from the nearest HIV clinic. Others worried about stigma or being recognized. Some were simply not ready to talk to healthcare provider face to face. So at Sustained Health Initiatives in the Philippines, we realized that if we wanted to reach the communities, we had to stop asking them to come to us. Instead, we need to go where they already go. That thinking led us to develop Sale Teleprep. First and foremost, our community-led telehealth platform that provides online consultation, peer navigation, and discreet courier delivery of PrEP across the country. It proved that digital health could dramatically reduce barriers in HIV prevention, particularly for people living outside major urban areas. But as scientists, we also looked into the performance of Sale Teleprep, and the data is telling us that access alone wasn't enough. Younger clients, based on our recently published study, were still underrepresented. Some people reached out for PrEP but were struggling with anxiety, depression, loneliness, and substance use. Others simply disappeared before completing their journey. HIV prevention wasn't the only issue. They were navigating much more complex realities. And that realization became the beginning of Project Anchor. Anchor stands for Advancing Navigation, Care, Harm Reduction, Outreach, and Rights. It is our partnership with Grindr for Equality, but I often describe it as something much simpler. Instead of waiting for people to find healthcare, we bring healthcare into a space where they are already feeling comfortable. Through Grindr, someone can connect with a peer navigator, complete a brief mental health screening, or be connected to a mental health professional and harm reduction services, all without taking that intimidating first step of walking into a clinic. It transforms a social networking platform into a gateway for holistic, community-led healthcare. What's been remarkable is how quickly we've seen the impact. Together with the Project Anchor plus Sale Teleprep, our PrEP reach has increased by 400% from 2022 up to 2026. And for Grindr alone, we have reached 279, way beyond our 70 target appointments. That was nearly 4 times that we had anticipated. The demand became so great that we hired a dedicated Grindr for Equality online counselor simply to keep pace with the number of people that is seeking services. At the same time, we wanted to better understand needs beyond HIV. So we introduced brief mental health self-screening directly into our digital pathways. From essentially starting from scratch, we have now completed 694 mental health self-screening and facilitated 231 referrals for people needing additional support. Perhaps even more importantly, the data helped us identify where people experiencing the highest level of distress were falling through the cracks, allowing us to redesign a follow-up process and improve continuity of care. So for me, that's the real reason and lesson from Anchor. So in conclusion, apps alone don't improve health. Algorithms alone don't improve health. It is the people that improve health. Technology simply allows us to find those people earlier, connect with them more quickly, and support them more compassionately. Thank you.